March 22nd is Diabetes Alert Day, so there's no better time to find out your risk factors for the disease. Liz Whelan of Cass Regional Medical Center joins us this morning with more on the subject. Now, why is this day so important, Diabetes Alert Day?
Oh my gosh, diabetes is an epidemic today, and we want to know, am I at risk for developing diabetes? So how do I do that? Well, the American Diabetes Association has made it very easy for us to figure that out. We'll just go to their website, or you can go to doihaveprediabetes.org, and you take a very simple test. And it's important to know for our life because of the complications associated with diabetes. And if we can get in early, figure out if we're at risk, we can make some just basic changes that will really change our life completely.
You mentioned pre-diabetes. What does that mean?
Well, you don't have diabetes, but now you're at risk for developing diabetes. So perhaps you're not able to utilize the food you're eating quite as well as a person that doesn't have diabetes. But pre-diabetes is really a risk. It shows you're headed down a path that you don't want to go down. So just some simple lifestyle changes, being more active, losing just maybe 5 to 7% of your body weight, and just looking at how you eat all make a huge difference in helping us delay or even prevent the onset of diabetes.
Simple changes that can change your life. So how do we know those risk factors?
Absolutely. If we take that test, some of the things that we want to think about that may lead us down the path to diabetes, and in today's world, inactivity obviously is one of the biggest things we see.
A lot of sitting in our culture.
Well, and our work has changed over the last 100 years. We don't necessarily define work now as labor. It's more of a keyboard type of thing. But if we're active every day, say even 30 minutes a day, you will really make a huge impact on your potential to develop diabetes.
So what if you take this test and you have those pre-diabetes signs or diabetes? What now?
Well, if you are in that pre-diabetes category and you pop positive on that little test, get out there and get moving.
Yeah.
Watch what you're eating, lose some weight. Those are just huge, easy things that you can do. But now if you decide, well, maybe I have diabetes, you see your primary care provider. He's going to really, or she will advise you in the best path for you to take. And the other thing I would recommend is you find yourself a certified diabetes educator. That person who is skilled in the management of prediabetes, diabetes, and helping people develop the skills appropriate for management, that person will help you develop your goals and help you really craft your life to a better health.
Now, when you talk about prediabetes, is there a certain age it's more common to see that disease emerging?
I think as we're looking at today's world, we're seeing more middle-aged folks who are overweight, sedentary lifestyle. We're starting to see the need for screening at about the age of 45, or if you have higher risk factors. Certain ethnic groups are of much higher risk factor than others. Women who have developed diabetes in pregnancy also are at very, very high risk.
Well, it's really good information, and we appreciate you being here. And you can find out more by visiting cassregional.org. You can take that test to see if you're at risk and you need to change your life and maybe meet with a physician if it's gotten that far where it's to actual diabetes. We appreciate your time.
Thank you so much.
All right, let's toss it over to J.